A hemorrhoid is a very common, often uncomfortable, swollen vein in the anus or lower rectum. When does a hemorrhoid become a concern? Parkview physician Dr. Sunil Reddy explains.
So hemorrhoids are actually normal parts of our body. In fact, all of us have hemorrhoids. Some of them are on the inside and some are on the outside. And we're all born with hemorrhoids. But as we grow older with constipation and other issues with the rectal area, the hemorrhoids can flare up. And that's when people get trouble. They can cause bleeding. If hemorrhoids get too large, they can start coming out, which is what we call a prolapse. And those hemorrhoidal prolapse can cause pain. They can cause mucus seepage. Really a lot of discomfort and sometimes stool smearing. And this is essentially broadly the hemorrhoid problem that people go through.
When a patient notices discomfort or other symptoms, an examination is typically the first step.
So when people come to us with issues that suggest a hemorrhoid problem, we first examine in the office, which is a simple exam. It's painless. We do a rectal exam to check if the hemorrhoids, do a small procedure called anoscopy, where we put a small scope, look inside the bottom, look at the hemorrhoid area and see how big these hemorrhoids are. The other main important reason we examine in the office is to make sure it is not something else going on, like anal cancer or rectal cancer, which can also present with similar problems.
Treatment for hemorrhoids can vary, but Dr. Reddy emphasizes the importance of addressing the root cause over a surgical procedure.
The hemorrhoid treatment depends on the nature of the hemorrhoid, the severity of the symptoms, and the size of the hemorrhoids. For minor symptoms where people have just bleeding from time to time and associated with constipation, we first begin with taking care of the root cause, which is the bowel movements. So we try to put them on some fiber supplements, laxatives, stool softeners, increase the water intake, a healthy lifestyle, physical activity, which all helps to regulate the bowel movements, and easy bowel movement will decrease the stress on the hemorrhoids, and that itself is enough for mild hemorrhoidal problems. Now, if the hemorrhoidal bleeding is too much and going on every day, then there is an easy treatment which we can do in the office. It's called placing rubber band on the hemorrhoids. It's a painless procedure, it's an office procedure, and it really works well for small hemorrhoids. If that doesn't help, and if the bleeding is really troublesome, or if the hemorrhoids are large and coming out, then we recommend a surgical procedure to excise or cut out these hemorrhoids. This provides long-lasting relief from hemorrhoidal problems.
Fortunately, in many circumstances, prevention is possible with a few lifestyle modifications.
Prevention of hemorrhoids actually begins with good lifestyle and good bowel habits. Taking a lot of fiber supplements, eating healthy, eating a lot of high fiber diet, drinking plenty of water, and making sure the bowel habits are regular. It's very important in preventing hemorrhoids. Childbirths contribute to hemorrhoidal issues as well, but usually that's temporary and goes away on its own. So essentially, the most important preventive aspect is good bowel habits. Sometimes people tend to stay on the commode and read books and browse through the internet. Staying in that position can worsen hemorrhoidal problems. Strongly recommend not to do that and follow safe and good bowel habit pattern.
This has been Making the Rounds, brought to you by Parkview Health.